Bismillahirrahmanirrahim. Assalamu alaikum and welcome to another lecture on human factors engineering. We were on module 1, that is body centered or physical ergonomics. In lecture 1-1, we discussed the role of anthropometry in the design of workplaces and equipment. In lecture 1-2, we will discuss a very important topic, that is work posture. This topic is further divided into different parts. In part A, we will discuss anatomy related to the work posture. In part B, we will discuss some principles and guidelines related to work posture. And then we will discuss a couple of ergonomic assessment tools that can be used to assess posture. So first, anatomy related to work posture. So these are the references that I consulted to prepare the lectures on work posture. So you can refer to them as well for more details on this topic. Learning objectives of part 1 include to understand the anatomy of spine and pelvis related to posture. So these are two very important parts of human musculoskeletal system that play a vital role in seated as well as standing posture. So that is your spine or backbone and pelvis. We will see what are facet joints, what role they play in maintaining a good posture. Then sacroiliac joints, the role of intervertebral discs, and finally the muscles, tendons, and ligaments, and their role in maintaining a good posture. And it is important to understand that these different units, that is the joints, muscles, tendons, in combination to maintain a stable posture. So they all play a role in maintaining the posture. So we have already discussed this thing in detail, that your backbone consists of different curves. So it is having cervical curve, then thoracic and lumbar, and finally sacrum and coccyx. So these two parts, spine and pelvis, support the weight of the body parts above them and transmit the load to the legs via the hip joints, as well as they are involved in movement. So the spine and pelvis again. The effect of weight bearing in the standing posture is to compress the spine. So as I just mentioned, that the spine is sort of S-shaped structure, and this S shape gives it a spring-like quality. So it is better able to absorb sudden impact. So just imagine if your backbone were just straight, so it won't be able to absorb many forces that it can now actually do. And one of the reasons is it's sort of irregular, S-shaped, something similar to a spring. So it is not like a column, it is rather like a spring. Another important point is that the vertebral bodies, the bones of your spinal column and their related structures increase in size from the top to the bottom of the spine. So why it is important? Because it is in accordance with the increased load that they must bear. So as we move down in general, their size increases. So cervical increase in the size. You can see that thoracic vertebrae also increase in size, and same you can observe for the lumbar vertebrae. So that is the beauty of the creator, that everything has been created according to its function so that it can perform the function in the best way. And you are aware of the pelvis, so there is a joint that you will see in detail that transfer the load of upper body to the lower body. There are two pairs of joints that every vertebra makes. So for example, if we take this vertebra, so it makes a joint here with this upper vertebra, and another joint here. So this is a pair of joints on the upper side of this vertebra. This also makes two joints on the lower side with the lower vertebra. So this is one joint and this is another. So in total, every vertebra makes four joints, two with the upper vertebra and two with the lower vertebra. And I repeat that these joints are slightly movable joints. We discussed three types of joints: immovable, slightly movable, and freely movable. So your facet joints are on the posterior side of your backbone, and they are slightly movable joints, and they bear especially the shear forces that are generated during your movement. They partially bear the torsional forces as well. So total four joints are made by each vertebra. So for example, if we talk about this one, so it is making these two joints with the lower vertebra as well as two joints on the upper side with the upper vertebra. So there are different processes or projections. So transverse processes are on the right and left of your uh, back, and then we have spinous process. So these are the bony projections. They are the part of your vertebra. So your muscles and ligaments attach to these projections. And most of the bending forces, I mean the forces that generate because as a reaction forces because of bending, are actually resisted by these ligaments and muscles that attach to these projections. And here you can see actually these four points where each vertebra makes joints with the attaching vertebrae. So this one, this point, this one on the upper side, and this one and this point on the lower side. Then there is a gap, a space through which the spinal cord passes, and you have this vertebral body that is on the anterior side. So at the top of this vertebral body will be intervertebral disc, and then on the upper side of that disc will be the another vertebra and so on. And on the lower side of this vertebral body will also be intervertebral disc and then lower vertebra and so on. So that is the basic structure. But with respect to our topic of posture, these facet joints bear the shear forces and torsional forces. The disc that is not shown in this figure, that is on the upper side of this vertebra in this case, bears compressive force. So for example, you are sitting right now, so your weight of your upper body is actually producing a compressive force that is resisted by these intervertebral discs. And the muscles and ligaments that attach to these projections or processes, they resist the bending forces. But as a whole, as I mentioned, that these units work in combination together because at one time, different forces are actually generated once we are moving or walking or for example, side bending and so on. So whatever is the type of movement that we are generating, different types of forces are produced simultaneously. So these different units, the joints, the muscles, the ligaments and disc, they work in combination. So I already mentioned these points. So there are facet joints on the posterior side, vertebral body on which there is a disc on the upper side as well as on the lower side. There is a disc. So this disc absorbs the compressive forces. And on this side, on right and left as well as on the back side, on these projections are attached the ligaments and muscles. And on this inferior side, this sacrum makes a joint with pelvis that transfers the load of your upper body to the lower body. So facet joints, and there are total two sets of joints. One pair is on the upper side, one on the lower side. And finally, this disc or the intervertebral disc. One more point is that these joints, the facet joints, where they join with each other, where each bone joins with the corresponding bone, there is a cartilage that acts as shock absorber. So that allows joints to move or glide smoothly against each other. So these are also slightly movable joints with respect to movement, and these are gliding or plane joints, as we discussed in module 0. I already mentioned this point that the intervertebral disc actually resists the compressive force. Approximately 80% of the compressive force is resisted by the intervertebral disc and vertebral bodies. So the points where this disc actually is touches the vertebra, that is your vertebral body. Intervertebral ligaments and muscles resist most of the bending, and facet joints stabilize the lumbar spine by resisting shear and torsion. So you can see there are different types of forces actually, and your backbone as a whole is capable of resisting all these forces, either compressive or shear or torsional, and of course the resistive forces as well. We will, we will briefly discuss the structure of intervertebral disc. So it consists of two parts. The outer ring is called annulus fibrosus. Fibrosus because it has fibers in its structure. It is very tough structure. Inside is nucleus pulposus, and the annulus fibrosus is a strong radial tire-like structure. This outer layer, this annulus is strong, sort of rubber-like structure. So it is strong, but it has some flexibility as well. The annulus fibrosus encloses the nucleus. So inside is this one. This is the nucleus. Nucleus contains a hydrated gel-like matter. So it's something like gel. It is hydrated. It contains liquid. So as a whole, this structure resists the compressive forces, and this annulus makes sure that this liquid inside its layer, that is the nucleus, doesn't actually sort of leak. If this annulus ruptures, if this annulus breaks, then this liquid sort of flows outside this annulus and touches the nerves that are there, that are emerging from the spinal cord, and a lot of pain is caused. So we will discuss it in some detail in our discussion on musculoskeletal disorders. But this annulus has a very important function to keep this nucleus enclosed and don't let it leak outside it. And that is one of the disorders as well. So the amount of water in the nucleus varies throughout the day depending upon activity. So generally at the end of the day, there is some loss of the water inside this nucleus, but that recovers once you take water or have some rest. So it returns to its normal amount. And you can notice that there are different fibers, different layers of fibers in this outer annulus. And you can see that this further consists of different layers. So annulus is something like an onion. If you cut an onion, so you can see it consists of different layers, one inside the other. So this one is the nucleus, but what is outside is the annulus. And you can see that there are layers one inside the other, one inside the other. And each layer is composed of different fibers. And of course, there are different processes for attachment of muscles and ligaments, and this whole for your spinal cord and nerve roots. So if we look at this disc in some more detail, so this sort of shown in black is the space for the nucleus, And you can see that annulus consists of different layers. So let's call it layer 1, this is layer 2, this is layer 3. And fibers in each layer are at oblique angles. So you can see they are not straight, they are not vertical, they are at some angle. Another important point is that the fibers in one layer are at a right angle to the fibers in other layers. So this is the angle of fibers in this layer, and corresponding fiber, for example, in the next layer, they make sort of 90-degree angle. And similarly, the fibers in layer 2 make a 90-degree angle with the fibers in layer 3, and you can see the fibers in layer 4 as well. So in layer 3 they are in this direction, in layer 4 they are in this direction, so they make a 90-degree angle. So you can imagine from the point of view of biomechanics why this structure is helpful in bearing forces that are acting in different directions. So you can read from here that the annulus consists of a number of layers of cartilage. So by structure, your disc is a cartilage. The fibers in the layers run obliquely and in different directions. So again, I mentioned that in the layer 1, they are at, say, at this angle. This is the angle. So in layer 2, they will be making a different angle. So they might be making this angle and so on, but they are perpendicular to each other. So the fibers in the layers run obliquely and in different directions, somewhat like the layers of a cross-ply tire. The outer layers run perpendicularly to each other. So as I mentioned. So that is very interesting feature of intervertebral disc. Then we have ligaments and tendons and of course muscles. So you can see from this figure, these ligaments are sort of covering these vertebrae. So again, this is, for example, vertebra 1, this is 2, that is vertebral body, and this is your intervertebral disc. So these are external ligaments, then we have internal ligaments as well. So as a whole, these ligaments provide stability to different joints of your backbone. So the vertebrae and disc are held together by a group of ligaments. Ligaments connect bone to bone, as we saw in our discussion on anatomy of musculoskeletal system, whereas tendons connect muscles to bones. Here tendons are not shown in this figure, but they attach muscle to the bone. In the spine, tendons connect muscles to the vertebrae. The ligaments and tendons help to stabilize the spine and guard against excessive movement in any one direction. So they control the degree of freedom of the joints. And again, you can observe these locations for facet joints as well. So these ligaments play a very important role in stabilizing the joints of your backbone. Just right through the center on the posterior side runs spinal cord. You know, the spinal cord is a part of your central nervous system, and nerve roots emerge from spinal cord in pairs. So you can see they emerge one on each side, right and left. So these are also numbered just like your bones. So for example, there is a C1 pair, that is the cervical nerve pair of nerves that is sort of adjacent to your C1 vertebra. Similarly, C2 pair and for example L1, L2 pair and so on. So we will discuss why they emerge in pair in our discussion during physiology topic. So the purpose of one of the major purposes of your backbone is to guard this very important part of your nervous system, that is the spinal cord and the related nerve roots. So you can read the details from the slide if you require. And we have discussed this joint repeatedly, the sacroiliac joint formed between sacrum and ilium. This is also an example of gliding joint or slightly movable joint. You transfer the load of upper body through this ball and socket joint that is formed somewhere over here to your legs. And of course, your backbone also bears some loads. We will discuss this topic in detail in our discussion on biomechanics. So for example, how much load is resisted by, for example, this L5S1 disc once we are holding a load of say 10 kilogram in front of our body, and some related examples will be discussed. This sacrum is if just like a keystone in an arc. So you have seen these structures in your life on bridges and some other buildings. So this central brick, you can say, the keystone, is the most important part of the structure. If you remove this keystone, the whole structure will collapse. So same analogy can be actually used to state the importance of the sacrum. So on one side there is ilium, on the other side is also ilium, and in the center is the sacrum. So this whole structure, that is your pelvis and backbone, is connected together through the sacrum. So if the sacrum is not there, if it gets damaged, or very important injury is the damage to the ligaments that are wrapping around this joint, then it is very difficult even to sit straight or even stand upright. So this is a very important component of your musculoskeletal system. So this is just like a keystone in an arc. So it is having a very important stabilizing function, the joining function in our body, and in maintaining any posture, whether it is a seated posture or standing posture. So the sacrum acts like a true keystone in this plane as is shown in the figure. So you can see here different ligaments. So A is showing the ligaments, the C is your pelvis, and this B structure is the sacrum. So if these ligaments get damaged, so that is one of the injuries related to the backbone, because these ligaments stabilize this joint. So one of the injuries related to lower back is some damage to these ligaments. Very important concept here is that once we are talking about designing the seated workplace or a chair, we focus too much on the lumbar spine. So for example, these are your lumbar vertebrae, but we ignore the sacrum. That is a very common mistake. And these are interrelated. So that is why we are calling it lumbopelvic mechanism. So angle of lumbar vertebra depends upon actually the angle of your pelvis. That is actually depending upon the angle of the sacrum. So if you are changing the angle of sacrum, so you can see the orientation of your lower back vertebra is also changing. So we will see in one of the principles as well once we move to the next segment that both these things are very important. The support for your lumbar vertebrae, L1 to L5, as well as spacing for your sacrum. So we'll see why that spacing is important. But you can imagine that is important in order to adjust your posture. If that spacing is not there and you are sort of forced to adopt a certain posture of your sacrum, so eventually the angle of your lumbar vertebra will also change. So the degree of lumbar lordosis depends upon the sacral angle, which in turn depends upon the tilt of the pelvis. So that is very important point with respect to seated posture. The simplest country may understand that one cannot put on the top story of a house until one has built the ground floor and foundations. Yet medical men are constantly trying to alter the position of the upper bricks of the spinal column without adjusting the base on which it stand. So very important point that without considering the angle of the sacrum, which depends upon the pelvis, we can't make a suitable uh, support for the lumbar vertebra. So these must be considered in combination. And finally, the muscles that play an important role in maintaining a good posture. So one of the very important muscles is a group of muscles actually. They are erector spinae muscles. Erector again means that, as we saw in the discussion on muscle, that the fibers, so rectus or erector fibers are straight, perpendicular. You can see this is the muscle, long muscle. And they also help in standing erect. So these are erector spinae muscles. So they are the main extensors of the trunk. So once you are bending forward, so these muscles actually resist the opposing force according to Newton's third. So they control flexion. So for example, when the trunk is flexed even slightly forward, or when a weight is held in front of the body, the erector spinae muscles come into play. Work situation that set up static loading of these muscles include working with hands and arms held away from the body. If you are moving your hand or arm in front of the body, or you are holding some weight on the front side of your body, or standing with the trunk flexed to reach for work objects placed too far away. So again, they play a role whenever you are moving on the anterior side, whenever you are moving your trunk on the front side. So these are the erector spinae muscles, the long muscle with straight fibers, just at the center of your back. And we will analyze the different forces that these muscles resist mathematically as well during our topic on biomechanics. Another important muscle is your iliopsoas, that is actually two muscles that merge at one point. So one is the psoas major and other is iliacus. So again, from name you can see iliacus attaches to the ilium and psoas is attaching to your lumbar vertebrae, as you can see, and they merge together toward the thighs. So at this point, these are also sometimes called iliopsoas muscles. The psoas and iliacus muscles, so they are separate muscles actually, but they merge in the thigh. So they are usually given the common name iliopsoas, so iliacus and psoas. So this muscle plays an important role during standing, walking, and running. So again, you can see that this is attaching your backbone with your thigh bone. So this joint is very important when you're standing, walking, and running. So they perform different functions when postural changes occur. So iliopsoas muscle. We have two more important muscles, soleus and gastrocnemius. So your calf muscles on the posterior side of your lower leg, and on the lateral side are the gastrocnemius muscles. So these are your soleus on the posterior inferior side, and on the superior side these are gastrocnemius muscles. So as a whole they are called calf muscles. In combination they are called calf muscles. So when a person is leaning forward, the activity of the gastrocnemius muscle increases. And another group of muscles is hamstrings, again to the posterior side of your legs. So these are hamstrings muscle. You are aware of hamstring injuries to sportsmen. So they also play a very important role, especially during standing posture, as well as when the stander leans forward or holds a weight or pulls something. So these calf muscles, combination of gastrocnemius and soleus and hamstrings also are very important to maintain a stable standing posture. So these are the important muscles and ligaments and joints that play important role. And finally, just there is a food for thought. So, for example, how texting could damage your spine. So, if you are standing straight, 0 degree angle, almost 0 degree angle of your neck, there is force on the neck equal to 10 to 12 pound. If you flex forward up to 15 degrees, it increases to 27 pounds. For 30-degree flexion, it is about 40 pounds. And as the angle increases, so does this force. And for 60-degree flexion, this force is about 60 pounds. In the next segment, we will discuss some important guidelines related to work posture. Thank you very much.